Hi everyone, welcome back to Beyond Your Knowledge. So now we are going to be studying a topic which is central obesity and restricted lung disease. So before we continue, I would like to share with you. So Luke 12:29-31 and says that do not seek what you are to eat, what you are to drink, not be worried, for all the nations of the world seek after these things, and your Father knows that you need them. Instead seek his kingdom, and these things will be added to you. Amen. So let's just amen. Okay, so now we're going to be moving to central obesity and restricted lung disease. So first, central obesity. So what do you think about central obesity? When we think about central obesity, basically is when you have an abdominal obesity, okay? So that your abdomen is going to be with more weight. So, but the patient is going to have an excessive of fat. So in the abdomen, in the abdomen, so around the stomach and the other organs. And then remember that if you have from inside you have your cavity, which is abdominal cavity, and inside you have different organs like the stomach, gastrointestinal system, which is part of the stomach, is part of the gastrointestinal system. So the intestine, the small intestine, large intestine, pancreas, all those organs. Now if you have a pressure from outside to inside pushing in your organs, so all these organs will be affected. And also because the patient has a fat deposition of fat, or also has high levels of fat in that area, so also the fat is related with cardiovascular diseases, or central obesity could be related with cardiovascular diseases, with diabetes, all those things. But now, besides to that one, the patient can develop restrictive lung disease. So when the patient has a central obesity, and now we're going to talk a little bit more about this. So what kind of, so when the obesity, so what does that happen to talk about? Okay, so now we're going to focus in restricted lung disease, how restricted lung disease is related, or how the obesity affect the lungs, and then we put a title or to this disease, which is restricted lung disease. Okay, now how is going to present? So well, let's just go here down. So the patient, this obesity alters the respiratory compliance. So basically the patient is going to have trouble to breathe normally. Okay, so the patient is going to have respiratory compliance. Okay, now what else? So which this thing, which is the ability of the compliance. So what is what is talking about compliance? It is the ability of the lung and the chest wall to stretch in response to an increased lung pressure. So that's mean that you have, for example, so you have your lungs, okay, you have your lungs here, okay, and so yeah, you have your lungs, and then you have your chest cavity, okay, so they're inside of that cavity. But when you are breathing in, should expand, and when breathing out, your chest wall should return. Okay, so now if you are obese, so and you lose your compliance, so that means that your stretching is going to be affected. So because the patient the ability of the lung, the chest wall to stretch in response to increase in the lung pressure, and then the respiratory compliance is going to diminish. Both a reduction in the chest wall and the compliance for increase your weight, and by a reduction in lung compliance due to microatelectasis. So the patients start to develop some atelectasis. Okay, so microatelectasis, remember that when we're talking about atelectasis, so basically that is going to be a collapse of the alveolar. Okay, so the alveoli is going to be collapsed. So, and that is the respiration, the interchange of gases, all those things going to be affected. So when the patient has microatelectasis. Now, yeah, also to compensate of this reduce of the compliance, remember that the patient has a respiratory compliance and is going to reduce. Okay, so and then to compensate this, so obese patients typically have to increase your respiratory rates with reduced tidal volumes. So that means they're going to have a rapid shallow breathing. Okay, so basically they're going to be breathing fast, but it is a compensation because for the poor compliance that the patient has. Okay, and for this reason, to compensate that, they reduce the compliance. So these obese patients, they have to increase your respiratory rates with reduced tidal volumes. Okay, now if you would like, or I will show you the pictures of the that we drew before. Yeah, we draw in another video. And so just keep in mind that we're mentioning that this patient has to increase their respiratory rates, but how they increase their respiratory rates? So so they increase their respiratory rate when they reduce, and then I'm going to show the picture when they reduce the tidal volume. I mean, it's sorry, it's not tidal volume. Okay, so now here we go. The tidal volume is right here. Okay, I'm going to, yeah, right here. This is the tidal volume. Okay, and this tidal volume in the patient that has central obesity, this one is going to be reduced, but it's going to have more respiratory rate. So basically in the patient that is obese, so could be just like this. I'm going to paint it red. So for example, so it's going to reduce this. Okay, so reduce this. Now do you see that the patient has reduce of the tidal volume but increase your respiratory rate? So while here the patient probably has more, while patient here has probably 12 respirations per minute, so this one probably is going to have more respirations per minute. Okay, so let me just write it here. This is for central obesity. Okay, there we go. Now let's just continue learning. There we go. In His name we pray, amen. So now that is the most common indicator of obesity related disease, is a reduction in the expiratory reserve volume. Okay, so when we go here to the expiratory reserve volume, now it's just right here. Okay, so this area here. So if there it is a reduction of this expiratory reserve volume, so that means that the expiratory reserve volume is reduced. This is one of the most common indicators for the disease related with obesity. Okay, now which is yeah, so just to mention, so which one is the meaning of the expiratory reserve volume? So basically is the maximum volume of air that can be expired after a normal tidal expiration. So you have a normal tidal expiration, as we can see here in the green line. Okay, so this is normal tidal, I mean the normal tidal, and then when you have the expiration, so basically yeah, so the maximum of the volume that this expired after the normal tidal respiration. Okay, so if I mention can you give me the meaning of expiratory reserve volume? Yes, So expiratory reserve volume basically is the maximum volume. So just see the connection. So expiratory reserve volume. So basically we're going to keep focusing the word volume. So it is the maximum volume of air that can be expired. So that means that this maximum of air that can be when you exhale, okay, expire, okay, and after a normal tidal expiration, okay. So after you are here, this after normal expiration. So remember, you inspire followed here, you inspire, oops, sorry. So you inspire here, you expire after the normal tidal expiration. You have your expiratory reserve volume, and then this is called your maximum. Basically the maximum is expiratory volume. Okay, now I got it. Okay, let's see. Let's just continue with obesity. Obesity has minimal effect on the residual volume. So what is the residual volume? Is right here. So that means that there is minimum. It's going to be minimally affected, this residual volume in the patient that has obesity, that is obese. So but the functional residual capacity, and then we need to look what is a functional residual capacity. This one, when I put together the residual volume and the expiratory reserve volume, both of those, so they are going to be reduced. Why they are going to be reduced? Because if your expiratory reserve volume is affected when the patient is obese, so that means because this volume is joining the residual volume, and even if the residual volume is fine, because if you have, for example, this is equal total 2, so expiratory reserve volume and residual volume, let's just put mathematics, so some math here, so you have 1 and 1, it's equal 2, so it's fine. This is the normal functional residual capacity. But if the maximum expiration, the expiratory reserve volume, instead of being 1, is 0.5, so it's lower than 1, so that means that then when you add 1 from the residual volume plus 0.5 from the expiratory reserve volume is equal to 1.5, so that means that your functional residual capacity, it is affected when the patient is obese. Obesity also can reduce your forced vital capacity by the same. So forced vital capacity, it is it's this one here, okay. So the just to recap the last sentence that I was mentioning, so remember that the obesity can also cause reduction in the forced vital capacity in the first expiratory volume in 1 second, which is abbreviated FEV1. Okay, so FEV1, so first expiratory volume in 1 second, and also can affect the total lung capacity, which is this one that we can see right here. All this, okay, all this is going to be reduced. Okay, now depending on the severity of the obesity of the patients or the body fat distribution, abdominal obesity causes greater problems impairment in the patients. However, it is important that we encourage our patients to lose weight, okay, but we need to help and avoid complications. there is no point. Okay. Yeah, so I think that basically is that, and well, thank you so much for watching, and hopefully you learned. That was a little bit I mean, it was interesting overall, but yeah, so I think that there are some those forced respiratory volume, all those mnemonic, not mnemonic, so those all those things. So we need to get used to hear it over and over again, and then we will eventually be every day better. So thank you so much for watching. God bless you, and we can do all things through Christ who strengthens us. Yep.